a warm summer day, a group of nursing students are performing a birth simulation at the Kapiolani Medical Center for Women and Children. These are just a few of the thousands of nursing students in the U.S.
At the time when I was going to school, I was married, and my husband at the time was in the Air Force, and we moved all the time. And we lived in 3 states in 1 year. So I was really looking for a quick route to my profession, and so ADN seemed to meet that need. I also actually selected my program in the state that we lived in at the time based on the best performance in the state at the time for nursing.
When I first started out in nursing, I went for an AD program, and so I got a degree as an RN with an ADN. At the time, it was okay to be taking care of patients, and because your job was your task and the things that you needed to do. I quickly learned as we started to grow in healthcare that you had to be on a lifelong journey of education. You had to keep up with the changes. And I progressed, and my highest degree that I have now is actually an MBA, because I knew that we had to learn the business of healthcare, not just taking care of the patient. So I think it's very important for nurses with ADNs to, if they want to stay in the profession and they want to keep moving forward, a BSN is very necessary.
I think the bachelor's degree really promotes, it actually took my critical thinking probably to the next level. I probably always thought of myself as a good bedside nurse and a critical thinker, but never really thought about searching the literature for evidence to support what I was doing. Never necessarily thought about the ability to question other disciplines or professions. Hadn't really thought about the interdisciplinary role from that perspective. So I think for sure it has elevated my ability for both bedside practice and for nursing leadership.
While attaining an associate's degree in nursing is important, a bachelor's degree in nursing provides a broader, more applicable perspective of the nursing field with a focus on critical thinking. A BSN is the first step to obtaining a higher quality career in nursing.
I'll share a story with you about a staff nurse that I had that did have an associate's degree and went through the program and did get a bachelor's degree. She was able to kind of expand her horizon and her vision of what nursing truly was, and she applied for it. She got it, and it took her away from the bedside for about 6 months, but it was an opportunity that she would not have had she not gone back to get the bachelor's degree. And it really opened her eyes as to the other options and possibilities of nursing besides just the bedside.
The need for a bachelor's degree in nursing has become more valuable over time. In fact, the Institute of Medicine, or IOM, recommends that 80% of the nursing workforce be baccalaureate prepared or higher by 2020.
I think there's many different paths that people going into nursing can take, but I would strongly recommend they go through a fluid program that enables them to get their ADN, get their BSN, and continue that education and that journey. Probably as a nation, we won't totally hit 80 by 20, but I am confident in the state of Hawaii we will meet 80% by 2020 BSNs.
Anybody who's pursuing a career in nursing, I would just give them a giant high five. For practicing nurses to go back to school, they really need the ability to attend the classes that they need to go to, the flexibility from the university side to afford working people an opportunity to complete their degrees, along with their employer accommodating that, and opportunity for scholarship and tuition reimbursement is key. It is challenging and difficult. You see people oftentimes at their worst and have to smile through that with them. But at the same time, it's one of the broadest fields you can get into. And like I said before, it's not just being at the bedside and giving meds. The scope of nursing is enormous and continuing to grow.
My name is Melissa Gampong. I'm the nurse manager of Kamehameha 3 Surgical Short Stay at the Queen's Medical Center, and I support the IOM's initiative of 80% BSN nurses by 2020.
I'm Laura Westfall, and I support the recommendation of IOM of 80% BSN or higher by 2020.
My name is Bridget Lai. I'm the Manager of Nursing Education for Hawaii Pacific Health, and I support the Institute of Medicine's recommendation for 80% BSN or higher by 2020.